Hi, I'm Ginille, a cosmetic nurse practitioner since 2013. We have time now to talk through any of your aesthetic questions, Botox, filler, skin, hair. I have been doing cosmetic treatments as a provider since 2013. I have gotten a lot of treatments. So this is me prior to doing any treatments. This is over 10 years ago. I am 38 years old. I have 3 locations in Los Angeles, Torrance, and in sorry, I was about to say Mar Vista. That's a Los Angeles office. Torrance, and then in Las Vegas. If you have questions, please drop them in the chat. Let me know. I like to do this to help educate people about cosmetic treatments. I know there's a lot on the internet you can find, but you can ask questions specific to you. I will also talk through our most commonly performed treatments and most commonly asked questions. But if you have any, let me know. Patients from here will come in and we'll do virtual consults after we talk through here. They book a consult. That's when we can really go one-on-one and go through your questions, your goals, tips on what to expect, how to prep for treatments. So if you have anything, drop it in there. I hope you guys are doing great. And in the meantime, I will talk about the treatments we offer in our office, our most commonly performed ones, and the most commonly asked questions. So we have traditional, your Botox, your filler. We have skin treatments. We focus a lot on skin health. We treat all skin types, all skin tones, all ages in our office. We have an entire skin membership and hair health program where we treat people on a monthly basis, taking care of their skin's needs. Somebody just asked, hey, Kalu, said, how many sessions you recommend for bio repill? Let me know what your skin concerns are. Anywhere from 3 to 6. If you have long time acne or acne scars, we're going to be doing more treatments. If you're like, hey, my skin is already fresh, I'm just looking for a little bit of extra glow, you can be doing less treatments. I love the bio repill. I think that one really stepped up my skin. My skin was already pretty healthy because I've been in this industry a long time. I've done a lot of treatments. Frequently do the Aerolase laser, but when I did the bio repill, that one just took my skin to the next level. I noticed like instant glow with that one. And the texture improvements with my skin. If you guys have seen some of my lives, I'm trying to set up my phone here so I don't have to hold it. I've told you my husband loves the bio repill. He says it makes him feel like he's rich because his skin is glowing. Our patients love it. There's no downtime with this pill. This is great for texture improvement, for acne, for fine lines, pores, beautiful glow for hyperpigmentation. So I love bio repill. You can stack that. Goodness, can I get my phone to sit up here? You can stack that the same day as your Aerolase laser, your hydrofacial, or your skin pin microneedling. So depending on your skin concerns, that can help determine how we combine treatments and how many that we are doing. A lot for me, I like the bio repill with the hydrofacial, just especially right now. Hey, thank you so much for sending the loves. Especially right now when it's like cooler, you're gonna get like deep cleansing of your pores, extracting of the pores with your hydrofacial, and then we put the bio repill right on top. So that's gonna help turn over skin cells faster, and again help beautiful glow, helps with pigment, fine lines, the texture. No downtime with either of those treatments. If you're trying to go more aggressive for acne, then we're going to be working with your Aerolase and your bio repill on the same day. If you're trying to go more aggressive for acne scarring but not active acne, that's when we can combine the Aerolase, the bio repill, and the skin pin microneedling on the same day. All of these things, you guys, anything I ever talk about, safe for all skin types and all skin tones. We do this from somebody very fair to somebody very dark. Everything we do, we want to make sure that you're going to get a beautiful outcome and a safe outcome. I mention this just because we see a lot of people of color in our office, and not everybody in the industry knows how to treat black and brown skin. So we want to make sure whatever treatments we're doing are going to be appropriate for you and your skin and your goals. Okay, let me see if there's questions that I have missed. I'm going to try to make sure. Thank you so much for the loves. For acne and acne scars, bio repill, yeah, I would do, you're thinking about 6. And you might be doing that the same day with your Aerolase laser. I think the Aerolase is excellent for treating acne. No downtime with that. Really good for active acne, hair removal, dark spots. Thank you, Pamela, for your hearts. Dark spots, all the DP, and I used to have a bunch of little tiny moles all over my face and my neck after my last pregnancy. It got rid of all of those. Any redness, rosacea, the Aerolase is excellent for. Aerolase works on pigment, but I felt like it wasn't moving pigment as fast as I wanted to see on black and brown skin. And so that is when we brought in the Bio Repill, and the Bio Repill really helped up the game for hyperpigmentation. Okay, Key said, I've lost 45 pounds naturally. I want to lose 30 more. Should I wait before getting filler? Not necessarily. Some people will start getting filler, you know, as they're in their journey. Other people will wait till they're all the way done. It's really up to you. I tell people, I'm like, you can wait. Once you wait, you know, we can see how your face lands. But other people are like, no, I want to start something now because I don't like the way my face looks now. I don't want to wait for it to get even more hollow, more sunken, and deal with that. They're like, get me in so I can start this. When we're approaching somebody that has had weight loss, we can do traditional filler, hyaluronic acid, or calcium-based filler. We can also do the natural filler. That is one of our most commonly performed procedures in the office. That is one where we draw blood from your arm, spin it in the centrifuge. It separates your growth factors and stem cells. We take that out, we heat it and cool it, and it thickens into a gel. And then we can inject that anywhere in the face. Wherever we inject it, your body will make new collagen in those areas over time. So some people like that when they're in their journey because they are able to, you know, as they're losing weight, they're able to get that collagen stimulation. So they're not so depleted as they're going along their journey. But you don't have to wait, or you can. It's totally up to you. I've seen people go both ways. Okay, let me make sure I'm not missing. I think I got those questions. Okay, let me see. Sorry, I'm trying to scroll. Have I gotten any work on your face? Yes, Jossie. I totally have done so many things. So this is me prior to doing any work. This was at 28 years old after my first of 3 kids. I got 3 now. The oldest is 11, and I got a 4 and a 2-year-old. I'm still breastfeeding this 2-year-old. That's a big, not a baby. He's a big toddler. And I'm going to have to go in 24 minutes because this is already past their bedtime. But anyway, so after my first baby, and I breastfeed for like 2 to 2.5 years every time, I lose a lot of volume in my face, my temples, my under eyes, smile lines, my cheeks, everything just looks more depleted. So after this first one, I felt really sunken. I felt really tired, losing a lot of volume under my eyes. I did filler underneath my eyes, into my cheeks, into my temples. I've also done filler into my chin to elongate my jawline. I've done it at the corners of my mouth to help the little, you know, marionette lines, or like where things start to look sad and droopy. I've done it there. So I've done regular filler. I haven't had regular filler in over 3 years because I've been pregnant and then breastfeeding this baby. So when you're pregnant breastfeeding, you're not supposed to be doing injectables. So I've been doing the natural filler, the one I was mentioning to you guys a few minutes ago, made from my own blood, my own body's growth factors and stem cells the last 2 years. And I think that has really helped me not get back to this. Because after my second baby, I got back to that. They just are literally sucking the life out of me. So the natural filler, that is the one, your body making new collagen in the same areas that we inject it over time. I have done the natural filler, temples, under eyes, smile lines, cheeks, corners of the mouth, my chin. I love the natural one. I will tell you guys, when I very first did it, I was like, I don't see any change, because it is not an instant thing. Like your regular filler will give you your instant results. The natural filler, it is progressively improving over time as your body's making new collagen. It can take up to 6 months for your body to make new collagen. So that's something to keep in mind. The healthier you are, the better your outcomes. If you are not trying to, if you're having a healthy lifestyle, not smoking, drinking, doing extracurricular recreational drugs or something, your body's going to have a better environment to make new collagen. So that's the goal. Overall, I'm pretty healthy besides eating candy. But I've cut back a lot. And so, yeah, I like the results. It gets better. I've done my whole face with it. I don't even know if I'm going to go back to filler. I love filler, but like the natural filler has done what it needs to do, and I'm very grateful for it. So yeah, I've also done Botox, my frown, my forehead, and my eyes. I've done skin treatments all day long. guys, I'm like, if you want to do nothing, no injectables, I'm like, skin treatments are excellent, safe for all skin types and tones. I was talking about the Bio Repo earlier. I love that one. I'm liking combining it with the Hydrofacial right now, as it's like a little bit cooler and drier. So I get extra glow, hydrated skin, no downtime with it. The Aerolase I love for acne, and like I said, I got all those little Morgan Freeman moles off of my neck and my face. I've had videos about that. Like, if you guys keep scrolling, I've been making videos every day for like 5 or 6 years. But you can see like my face gets full in pregnancy, because when I get pregnancy nose and all of that. You can see when I get sunken from the babies drinking off me. You can see the little hormonal, all those little DP and moles. And then I clean them up with the laser. But I've done all the treatments. I love it. Anything I talk about, like, I really stand behind, and our patients love. It's not just me. Again, we treat all skin types, all skin tones in the office. I want to offer treatments that make sense, that are safe, and that are going to get the results that people love time and time and time and time again. So I think the skin health is the best one. And if you don't want to do skin treatments, if you don't want to do any of this stuff, oh, thank you so much for your hearts. Don't do any of it. But I'm like, just wear some sunscreen at the very, very least. Black and brown people too. They'll be like, oh, I didn't know. Today I was talking to a patient, and one of her biggest concerns that like we got on our virtual call was for hyperpigmentation. She was talking to me about the different skin things she has done. She's like using like some really advanced skincare. And I said, okay, that sounds really good. Talk to me about your sunscreen. She's like, I use sunscreen. I said, okay, what time do you apply it? She said, in the morning. I said, when else? And she's like, no more times. I said, okay, talk to me about your sun exposure. She's like, oh, I'm always by windows, at work, at home. I drive. I'm like, oh, no. Like, you're getting sun on your skin. And if we get sun on our skin, we're going to get dark spots, and it's harder to treat hyperpigmentation or dark spots on black and brown skin. So I'm like, at the very least, use your sunscreen, even if you don't have hyperpigmentation. Even if you're like, oh, I don't care about that, I don't care about the aesthetic stuff, at least protect yourself from skin cancer. And it can happen to black and brown too. So yes. Okay. Does sauna worsen hyperpigmentation? I've seen it with for people with melasma, like the heat can. Okay, your skin is glowing. Jossie, thank you. I'm telling you, it's a bio repill. I did it probably the last time was almost 4 weeks ago. I was like, oh, I should do it again. But then I'm like, dang, my skin is already like feeling really healthy and glowy. So I've just held off. I love the bio repill. I told you guys, my husband loves it. And he gets all the treatments, but he's always like, I can't tell any change. I don't see a difference. I'm like, okay. But this one, he asks all the time. He asks like every 2 to 3 weeks, like, can we do the pill? Can we do the pill? It's like, I thought you can't tell a change. He's like, I can see my skin glows with that pill. He's like, that's out of all the years I've been doing it since 2013, giving him treatments and all that. He's always like, I don't see a change. With that one, he's like, I look rich. and I get what he's saying. Like, the skin is just glowing. He's like, people treat me different. He's like, my skin looks better. So anyway, it says I have 39 messages. I'm going to try. Key said, I'm coming to see you in 26. I cannot wait to see you. My derm just told me to wear sunscreen, and I looked at her sideways. Nicole said that. No, she's right. I didn't believe it. But when I started in this industry, I would see people that looked like 10 years older than I thought they were. It was because their skin was so sun damaged. And then the ones that looked like 10 years younger than I thought they were 10 years younger than they actually were. I'm saying they were telling me they were using a retinoid for a long time and sunscreen and doing small amounts of Botox. So sunscreen really plays a difference. Sunscreen, face, neck, chest, hands, like, do it. Because some people are really good about their face, but then they're missing this, and then it's like 2 different tones. Like, their face looks good, but then they have all this like sun damage on their neck and chest. You don't want that. So do it. It's going to be the best investment. So I'm like, you never have to do any treatments, but definitely wear the sunscreen. It makes a big difference. Family members of mine, my husband's black, his brother, like, they're like skin type 6, like darker. And I remember him calling me like, I have all this, like, I have all these dark spots, and I could totally see. I was like, oh, I can see, like, you wear a hat, and then the rest of it, like, this was like light, and then the rest of it was all dark. I was like, you need to wear sunscreen. And he was like, no, I don't go in the sun. I was like, okay, I was going through it. He's like, oh yeah, at work I sit right by the window. He's like, I love to do that. I was like, okay, well, you're getting sun exposure. He's not here to, like, with me, because he's in another state, to get skin treatments. But he started wearing sunscreen. He was reapplying it. That's a big thing. You got to reapply it. And he started reapplying it. In 2 months, he called me. He was like, my skin looks the same color. He's like, it's all the same. He's like, the dark spots went away. I've heard that from other family members, from patients all the time. It's like, even if you don't do skin treatments, Wear your sunscreen. Sorry. Some of the microneedling, CKE said microneedling for the win. Yes, microneedling is amazing. We do this in our office. Safe for all skin types and tones. Really good for texture, acne scars, dark spots, collagen stimulation, fine lines. This one does have a little bit of downtime because you get a little bit rosy after it, and you have to like keep your hair off your face, your hands off your face. You don't want your kids or your pets to touch your face because we are making these micro injuries in your skin with this electronic pin. You're numb, so you don't feel anything, but we do these little micro injuries. When your skin senses that there's an injury, it's going to come and repair itself, and then that's what helps with that whole collagen response, fine lines, pores, skin texture, dark spot improvement. You got to be very vigilant about, staying out of the sun, and then infection control for those first 48 hours as those little micro injuries are open. No makeup. So that one has the most downtime. It's not even that bad. It's like 5 to 7 days. The first few days you're like a little bit rosy-ish and maybe a little bit swollen, and then from there you might flake or you might have slight peeling. That happens. It's about 5 to 7 days. So that one has the most downtime. The other ones have no downtime at all. Even with the downtime of microneedling, it's not that bad. It's really not bad at all. All skin types and all skin tones can do it. You can combine your microneedling the same day with your chemical peel and with your laser. These are working at different layers in the skin. The patients that are combining them, they get to the point faster. They see the results faster. They're probably the happiest. They just get there quicker as opposed to doing just one treatment on their own. Again, I love all these treatments on their own, but when we start compounding them, you can see results a little bit quicker. Sarah said, I keep hearing about Softwave. Is it really that great benefits? I've heard about it too. I will say, I don't know. I don't jump on the bandwagon for any new things. I have just done it in the past. I've been in this for 13 years. I have seen these companies bring in new products and they hype them up and they put a lot of marketing dollars behind it, and it gets the providers excited and it gets the patients excited. And then after a while, it dies down, and I've seen companies come and go, completely flop, they cause more harm than good. They flop, they go out of business. I've seen people get treatments and they hype them up, and then when they come, they're like, oh, actually that wasn't even that great. So Softwave is still a little too new to me to really stand behind it. I don't really believe in any of the non-surgical skin tightening devices. I have worked with several of them over the years. I've worked in different medical spas and we had different ones, and the results were always people would be like, I think I saw something, or they didn't see anything. There's somewhere they think it got worse. I'm just like, dang. At a certain point, if you really want tightening, go get a surgical consult. I know what we can do with non-surgical. I know what we can do with collagen stimulators, with fillers, with our skin treatments, our lasers, our pills, microneedling, our Botox, our fillers. But at a certain point, I'm like, if you really have excess skin and you're really trying to tighten, the best result's going to be a surgical one. If you have mild, oh, this little piece right here, maybe you're going to see that, but I'm not super hyped about it yet. Sorry, Sarah. I'm just telling you my honest. If you do it, go see somebody that does it time and time again, that can show you multiple before and afters of people that look like you. I haven't seen it yet. I haven't seen it. So it says 25 messages. I'm trying to catch up. Sorry, guys. If I miss anything, please put back in there. You see, it takes me 10 minutes to answer one question. Crystal says she loves her Morgan Freeman moles. Okay, go ahead. If you love them, keep them. For me, I didn't have them before, and then I got them a bunch after my pregnancy. And they were just all over, and so then I zapped them off. Okay, let's see. Is that really your curly hair? Yes, Zara. This is my hair, naturally curly. I used to straighten it all the time. I probably haven't straightened in 8 years, but I was straightening it all the time. I would get out of the shower and it was straight, after I washed it. And so then I was like, this is probably very damaged. So I stopped straightening it. I see Donatella for my haircuts. She is at Curls 1-on-1 in West Hollywood, and she's excellent. I've never colored it. I just wash it and then I diffuse it, and I wash it twice a week and just leave it. Okay, 45. I want to try Botox, but also too nervous to just do it. But I love seeing your work. I appreciate you, user 696183. Thank you so much. Yeah, don't do anything, guys. I tell everybody, I'm like, don't rush it. Don't be random about these treatments when it comes to your face. I want you to make informed decisions. I don't want people making just on a whim. I try to come, I'm here. There's other amazing providers that are here. Don't rush your face. You are beautiful with nothing. So I just say none of us need this. Now, I love Botox, I love filler. I'm like, if you decide you want to do it, I'm going to show you. Usually I'm like clicking through photos. I just didn't set them up. I was like, I'm going to give myself 30 minutes today to come and connect, but I didn't come and click through patient before and afters. You can see a bunch of patient before and afters on our page. But, you know, I tell people, like, if you're going to do it, I'm going to get you a very amazing results, like straight up. You're going to look like you're going to look refreshed. You're not going to look overdone. That's never, ever our intention. But I also tell people, like, if you're not feeling it yet, don't feel the pressure. I'm not the one to be like, yeah, get Botox. That's not me. I love it for myself. Not everybody wants Botox. Some people are like, I love my wrinkles. I'm like, girl, power to you. You are beautiful. I'm not here to make anybody feel weird or self-conscious or like they should be doing this. This is just, if you're going to do it, make informed decisions. Don't rush your face. Okay, I'm 46. I've lost a lot of weight. I'm looking into some filler and tox. Amber, yes, a lot of people after weight changes will notice volume loss to their temples. Their cheeks don't look as lifted. The smile lines look heavier. These corners of the mouth, marionettes, look heavier, and their jowls are kind of hanging. I've been seeing this a lot over the last few years with people having weight changes. You can totally approach this with filler, natural filler, collagen stimulators. Biggest thing is we want it to look fresh and like you, not overdone. Don't rush it. Like, do some, let it settle, reassess 6 to 8 weeks. We can always do more later. We just don't want it to be overdone. What about Sculptra? Is Sculptra or filler better for the cheek area? For Ashley, Sculptra is a great collagen stimulator. It's just not an instant effect. It depends on what you want for your cheeks. You know, for somebody, if they have more of like this area that's kind of sunken in, I like Sculptra to like help give a little bit of volume. If you're trying to get like, oh, I already have full cheeks and I still want a little bit more, I want this lateral highlight, that's when I'm going to go in with your traditional filler. Sculptra is not going to give you a lot of contour. It's more of like a very subtle little bit of volume. Really nice for skin texture. So yeah, I just have to see you. I'm trying to see if I can see you, Ashley. Oh, you're so beautiful. I'm like, but you make probably some filler. It just depends on your goals. So this is why we'll talk through your questions, your goals, tips on what to expect, how to prep for treatments on our virtual calls. People have been like, Ginille, you don't have any virtual call times available. I'm sorry, guys. I just told my team to add some more. Like, I do them on my days I don't see patients. I will do virtual calls like my whole day, and then my head hurts after. I love doing virtual calls because I love like talking to people, but then I just talk so much so my head starts hurting. But we can go through all of your things, and we talk about like what can serve you. We start building out a treatment plan. And then I just say, this treatment plan is fluid. Like, you may come in and like say, hey, I thought I wanted to go the natural filler way, but I decided I actually want to see the filler. I want to do regular filler because I want to see the results immediately. Biggest thing is that we talk. I ask a lot of questions about you, about your lifestyle, about what's going on, about your goals. Oh, you're getting ready for this event. Oh, you just got this new job. And so what's your job? Like, oh, a sex worker versus a priest is going to have a different aesthetic preference, very likely. Another girl just said, hey, I cut all my hair off, and so now I'm noticing this on my face. Like, all the things we talk through. You see, I can sit here and yap. I wish somebody was talking to me, to my face, but I'm just answering these questions. But it's really nice to, one, know who I'm serving and know how this is going to fit into them. The more I know about your lifestyle and what you like, the better I can serve you. My team and I. It's not just me, guys. We have an entire team of amazing providers that I love and stand fully behind and trust them with my face. And you can read all their reviews. Like, the patients love every single one of them. I would not have anybody on our team that was giving our patients a headache or me a headache. Like, it's just not worth it. But the girls are awesome. We just had our girls retreat in Malibu, Calamigos Ranch this past weekend, and that was so fun. Okay, let me see. It says 49 messages, and it took me all the way down. So I'm going to read the ones, and I'm going to keep scrolling back up. I'm going to try to answer as many as I can in 7.5 minutes. So what about frown lines or jowls? Frown lines, if it's these, Botox can prevent you from doing this. Stops the muscles from flexing so hard. How much Botox you do really depends on how strong your muscles are, how big the area is, what you want the outcome to be. So if you want to be really restricted and flat, you're going to do more. Or if you have really strong muscles, you're going to do more. If you just want to soften them, oh, I'm in acting, oh, I'm a therapist, I'm a teacher, I still want to frown, you do less. The more you do, the longer it lasts. The least you do, the faster it wears off. Your dose may change over time depending on your goals and what's going on with life. Okay, Alex said, can you do facial balancing without the actual filler? You could potentially do it with the natural filler, depending on like how much volume loss, how much contour you're trying to get, what your goals are. We could also be doing with Botox. Botox can like, you know, help slim the lower face. It can help tighten through the neck. It can help give a little brow lift. So there's a lot that we can do without filler, but it just depends on, like, I got to look at your face and decide what's going on. If you have a lot of volume loss, or if you're like, I want something like really, really structured, lifted, like the natural filler is not going to give super contoured. So we just have to talk it through. Hi, Jerry. I hope you're doing so great. Okay, Cassie, what was Jerry saying? Let me see. I have a lot of hyperpigmentation, dark marks on my face. What do you suggest for that? Jerry in here answering the questions for me. Yes. So sunscreen first, and then the Aerolase is excellent. The Bio Repill, the Skin Pin Microneedling, and we also have an entire skin line, Jossie skin line. So I formulated this to work hand in hand with these treatments, to work for all skin types and tones. We also have prescription medications. Sometimes we will prescribe hydroquinone, like a fading cream, just depending on the patient and what's going on. Great to see you here, Jerry. Okay. Let me see. I don't hate wrinkles. I get the chance to get them, but I'm okay with softening. Megan, I totally get you. And that's what's so cool about all of this, guys. Like, and if you look at our pictures of our patients, like, they look like themselves. I'm not trying to transform every face into the same face. Like, that's not it. We're not trying to all have the same celebrity face. That's not it. Like, you're gonna look like you. When you see our patients, or if you flip through the top of my page, there will be like patient before and afters. Like, the people look like themselves, especially we see a lot of people of color. Like, their features, they're like, I don't want to get rid of my, I like this thing about me. So we want to enhance. We're not trying to morph all the faces into one. And it's really cool. You said, I don't hate your wrinkles. I'm okay with softening them. Everyone is going to have a different aesthetic preference. These things can really be made to serve you. So I have some people that are like, freeze me, I don't want to frown at all. And there are other people that want to keep some lines. And that's totally cool. That's what's so neat. And that is why we got to talk about you and your goals, and why our team, we have you, like, we make you have an active voice in this treatment plan. It is not just us looking at your face and saying, this is what we're going to do, and you're going to do this. Or you're not going to just say, my sister did 50, so I want to do 50. I'm like, I don't know your sister. Even if I did know your sister and you guys are twins, it could be a completely different thing. You guys got different jobs. You guys different preferences. You sleep on this side, she sleeps on that side. You chew more on one side, she animates like this. All of these things play a role in how we do your treatment. It is not random what we do to your face. Like, there's a lot of thought behind each and every poke, any little thing that we do. It is not random for everything. I will stand. You could ask me every poke. Why'd you poke it there? I got a reason. I got a reason. Why'd you use for? I got a reason. And I'm probably gonna give you a long list. You guys are probably, shut up, quit talking so much. I get it. I'm sorry. But it's not random, and I love it. I just can't stop talking about it. Okay, let me get back to these. Okay. Someone said bunny lines. Bunny lines, this right here, if you scrunch your nose, sometimes people will have those. You can soften that with Botox. Okay, what have I done? Cassie, I was saying earlier, I've done Botox, filler. I've done filler on my eyes, my temples, my cheeks, my chin. I've dissolved fat under here. I've done Botox into my neck, Botox my frown, forehead here. I've done all the skin treatments. That's all I've really been doing besides the natural filler this year, because I'm breastfeeding this big baby that's probably going to come in here in a minute and holler at me. Someone said, I get my first Easy Gel with PRF session tomorrow. Is Easy Gel PRF good for jowls? To help camouflage them? Yes, if we go in front of them or sometimes behind them to camouflage them, and into right here, we can help hide them pretty good. If it is very, very, very jolly, or a lot of excess skin or excess fat, limitations on how much we can hide them. But I love Easy Gel, guys. You got to remember, user 6, 5, 8, 4, and 2, 3, 4. Takes multiple sessions. You want to do a minimum of 2 sessions. If you're like mid-30s plus, you probably might want to do 3. Retreat the same area. You're going to do it about a month apart. Your sessions, 1 to 2 months apart between your sessions. Just know it gets better over time. Your body, it takes time to make collagen in those areas. If you are looking for an instant result, PRF Easy Gel is not for you. This is not the instant result. This is the one. Are they ringing bells for me to come, my kids? This is the one that your body's making new collagen, progressively going to improve. The healthier you are, the better your outcomes. When I very first did mine, I'm breastfeeding this big baby that I'm going to have to go to in a second. I was like, I don't see a change. I didn't see a change. I was like, this is dumb. This is wasting my time, because I'm used to putting filler and like softening the line. I will tell you, after I haven't done filler for over 3 years, I did not revert back to that. This is me 11 years ago. Like, my filler from 3 years ago is not still lasting. Like, maybe some of it, but not all of it, because that baby was sucking my fat away from breastfeeding. The natural filler has really helped me not look so haggard, like in all these areas. When we inject, as our team, we're not here to just line chase. We are thinking about underneath the skin. What's happening to fat pads? Where are fat pads separating? Where are fat pads sinking? That is what directs us, not just these lines. So we're thinking about underneath the skin, pull it back, and we're thinking about underneath what's happening. And how are we injecting so it looks like it looks the most natural, it's not overdone. If you look at our people, they don't look weird, they don't look overdone. That's the goal. And I don't care what age, I don't care what race. Look in our office. I see everybody all day. I see men, women, all colors, all races, all ages. That's the goal. They look fresh. Okay, I'm gonna have my timer to go off in a minute. I have my consult with you next week. I can't wait. I can't wait to see you either, Nitra. Okay, do you think 20 is too young for facial balancing, Maria? Possibly. The face is changing a lot at that age. However, some things, I don't love, that's like so young. Some things I've done are like for somebody like their nose, if they have a big bump and they're like, hey, I'm not going to get a surgery. I want to camouflage this bump. You can do that with filler. I want to, something like that. Or sometimes there are people who are like, hey, my chin is really recessed. They're not growing into their chin. They're like, hey, my doctor said I should be getting a jaw surgery, but it's not, they don't need it for, they don't need it for life, like for chewing or whatever. They just should be getting a jaw surgery, but it's not, they don't need it for, they don't need it for life, like for chewing or whatever. They just said filler. But in general, 20, I'm like, just wear your sunscreen, use your retinoid. If you want to start getting some hydrofacial, if you got acne, we can do the laser. But 20, I'm like, your face is still changing a lot. Most people will start seeing like volume changes, start seeing like these signs of aging in their face in their later part of their 20s into their 30s. That's when they'll start to be like, oh, like I'm starting to see like this little bit underneath my eye or these cheeks. Even when they're seeing it, it's pretty subtle at that age. Unless they've gone through some major weight change or some sort of injury, facial injuries, we've seen a lot of traumas. It's pretty subtle, and I'm like, oh, okay. They're like, only I get it. I'm like, yeah, I bet your friends and family think you're crazy. They're like, they do. I'm like, because it's subtle. I get it because I understand this from like a work perspective and an aging perspective, but I'm like, no one sees that line but you. So here's how we can do it. Usually in these like early or these like mid-20s, I'm like, do the natural filler, like just you're young and your body can make new collagen. My bell rang, but I'm just giving myself 4 more minutes. Okay. Bunny lines, we talked about that. Botox. Is Morpheus8 really that great? Not really. I haven't ever said that. Can I do facial balancing? Alice, we talked about that. You can do facial balancing without filler, with a natural filler to an extent. Megan said you're beautiful. You are beautiful. Thank you. God bless you. Hollow under eye treatment, natural filler or hyaluronic acid filler. Hyaluronic acid, if you don't get puffy, if you don't retain a lot of water, if you don't cry a lot, have bad allergies. If you do, don't get hyaluronic acid filler underneath your eyes. It will make it look more puffy and look worse. So you got to be a candidate to do regular filler. Regular filler will give you your immediate lift, whereas the natural filler, it takes time. So what can I do besides Botox for my deep frown lines? Please help. Botox is really going to be the one to stop those muscles from flexing. So it's because this muscle and this muscle, they're like flexing. So Botox relaxes them so they don't flex so hard, so the lines don't get etched in. That's going to be your one. Other things you can do without Botox, you can do skin treatments, microneedling to help with the texture. Hey, thanks for the hearts, babe. For the texture, you could do your laser, you could do your chemical pill to help, your sunscreen, and then just try to tell yourself, like, don't frown. Some people, they say, my mom told me never frown when I was a kid, and so they've kind of trained themselves to not do it. So that is something. My jowls, they said Botox won't help them. Just start with filler. Thoughts? Denise, Botox is not going to take them away, but what you can do is like Botox into this neck band right here, into our neck bands, our platysmal bands. A lot of times that like runs right into where the heaviest part of the jowl is. If you do Botox there, it could give like a little, it's not going to make it like surgery, but it can give like a little bit more definition along the jawline. Sometimes I pair that with filler in front of the jowl, maybe into the chin, maybe behind the jowl to help camouflage it. If it is very, very heavy jowling, sometimes I'm like, hey, do you want to do a surgical consult? But look at our page. We have some really good before and afters of jowls and like jaw lines. Yes. Okay. Let me see. For microneedling, is PRP better than HA serum? I have pores on my cheeks. I'm trying to improve. PRP is great. I think it helps like with the healing, even though microneedling in general, the healing is pretty fast. I don't think you have to use PRP topically with microneedling, but it's fine to add on. They're both great. We use a water-based gel for a majority of our microneedling sessions. Here and there, somebody will be like, hey, I want to draw my blood and do the extra, and they want to pay extra for it. I'm like, I don't think you like totally need to do that. Okay. I'm 82 messages and I'm never going to finish. Should we use face shield or sun visors after treatment? Yes, Crystal, do that. Jerry, there he goes. I hope you're doing so great. I see where you first mentioned hi to me. For slight 11 lines, Botox or something like microneedling. Botox is going to stop the muscles. Microneedling will help stop the etch lines. You can see I kind of got some etch lines because I don't have Botox because I got that baby. Got to go feed. Wow. Okay. I guess even for black and brown folks, I didn't believe it. Oh, I think we were talking about sunscreen earlier. What should I do for nasolabial folds? Yeah, that's people always ask us that one. So these smile lines. You can use traditional filler, hyaluronic acid, or a calcium-based filler to soften. You can use the all-natural filler to start making new collagen under the area. What you don't want to do is overfill it. Don't try to get these lines all the way gone. If you try to get these lines all the way gone, guys, it's going to look puffy. You're going to have some lines. We talk, we move, we smile. Like, you're going to have some lines. If we try to chase them all the way gone, it's going to look overdone. I need to go get these babies in a minute. So don't rush it. Don't overfill. I think those are my main things. Oh, other thing is, you got to also think about what is causing these lines to get heavier. So sometimes it's because we're losing volume in our mid-face and through our cheeks. So sometimes it's there. We're also looking at other areas. We're not just line chasing. I'm thinking about what's happening. We're losing fat here. Everything is sinking. Should I be put in filler to like restructure through the cheeks to help give this illusion of a lift, not actually pulling you back the way surgery is, but help create this highlight so the cheeks look lifted and pulled back through the temples. And then that's when the highlight is up, it's going to take less focus off the line, or I might not even need to do the line after. Also, the deepest part of the line is usually right here. We lose bone right here, so this starts to sink back. So yeah, usually sometimes if I just do this, a lot of times if I just go right here, the whole line looks better without me chasing the line, and it looks very natural. But it would just look weird if you try to take it all the way gone. Okay. Okay. Sheesh, I'm sorry. I missed it. 95 messages. I'm trying. My brow muscles was always tender. I got Botox and went away. And so did my weekly headaches. Yes, Botox works very well for migraines, for TMJ symptoms, clenching, headaches, teeth grinding, jaw pain. It works excellent. Yeah, you can do it into the temporalis muscles, into the masseter muscles. Those are chewing muscles if you have TMJ symptoms. Headaches, we go through there as well. Okay. Hi, Jocelyn. Hope you're doing so great. Easy Gel or Sculptra? Ooh, I love Easy Gel. They're both great, and I've had them both, but I really like the Easy Gel. Sculptra, you can't go underneath the eyes, into the lips. Easy Gel, you can go everywhere. CO2 or Softwave for stretch marks, Valeria. I'm not a pro on Softwave. I was talking about that earlier. I was like, I'm still iffy on that one. Okay, I've always had, this is Megan, wildly highly expressive brow. I've given some looks in my day. So you can use, if you got one that is like up, you can keep it that way if you want, or we can do Botox to like tone it down so it doesn't like do the rock thing all the time. Okay. I noticed I have a dimple in my upper cheek and your before pic. What did I do? I did filler. I was losing a lot of volume after that baby sucked all that fat out of my face and my temples. So I did filler through there, and I've done the natural filler. I had Nefertiti lift. I feel like that and chin Botox didn't do anything. It's been 3 weeks. So Yasmin, I need more info. Depends on how many units you did in the Nefertiti lift. Some people tell me that. I'm like, how many did you do? They're like 12 units. I'm like, that's not it. And the neck, it can take like 60 units. A lot of providers don't start that aggressive, and I agree, just because it's a lot. If you do too much into your neck, it can feel like kind of bobbleheady. So usually I start people like 30 to 40 units in there, 30, mid 30s to like mid 40 units, depending on how many they have. And then I reassess at 2 weeks and say, hey, you know, did that help? And you don't feel like it's hard to swallow, you don't feel like a bobblehead, we can always do more. Chin Botox is good for dimpling, to relax the dimpling. I also just don't know, Yasmin, what your goal was in there. Okay, what to do for smile lines? We talked about that one. I've been going back and forth to get cheek filler to help my smile lines. Thoughts? Let me see if I can see your picture. I can't see your photo. Cheek filler, it's going to help create, it can help create this illusion of the cheeks looking lifted. The highlight through here, not going to necessarily soften the lines, but it can bring the attention up here where the lines don't appear as apparent. I think I was mentioning this a few minutes ago. Easy Gel or Sculpture, I said that one. Can you still gouache it with fillers? Yes, but I would wait till that is like settled. Let it settle. Take 6 to 8 weeks for your filler to completely settle. It is moldable for up to a month. If you're doing gouache like that, you are going to be displacing your filler. So don't touch it, don't touch it, don't touch it. Let it be. Marie, oh hey, I know who you are now that you told me in clinic. I love you so much. Easy Gel, Jerry said helped with under eye hollows, reduce the shadow that look dark. I love Easy Gel. Jerry over here telling you guys about it. I love it. PRF, yes, for the win. I love it. Towers, let them fill up. Share this out. I don't know what Megan was saying to me. Okay, advice for smile lines and minor jowls. Traditional filler, natural filler. We're not trying to overfill these lines. And then when we're doing the minor jowls, we're going to go in front of it. We call this area pre-jowl sulcus. So sometimes we're going in front of it, maybe into the chin, so that we don't want to just like make this wide and then your chin is short. So into this lower face and sometimes into the marionettes to help hide them. Okay, I think I got them. Did I get them, guys? I need help. What to do for under eye wrinkles? I've tried everything. PRP, Easy Gel, Nano Fat, KK Perry. Let me see. Can I see your eyes? I cannot see, but you're beautiful. Okay, so if it is wrinkles when you smile, a little bit of Botox. You might have tried that. You can't do too much Botox underneath the eye. Botox will prevent like these little ones. If you do too much, it'll pull down your eyelids. So only a little bit. You've tried PRP, Easy Gel, Nano Fat. If the wrinkles are there because it's like volume loss, have you tried filler? That's just going to give you the instant lift. If you're a candidate for filler, that's a consideration. Also, if it's at... I'm going to go get these kids, guys. I always get on live. I say, I'm going to come for 10 minutes, and then I come for 10 hours. If it is at rest, you have little lines, and you're not animating, microneedling, you can go all the way up, stay on bone. You can get really close up there. Your retinoid is going to be helpful. Fine lines, pores, skin texture, dark spots. You got to sandwich your retinoid with your moisturizer before and after, so because the skin here is a lot thinner. Yeah, those are some approaches I can think for eye wrinkles. If you still have it, if it's excess skin, I had a patient that did a surgery called a skin pinch, and like they took like some, I didn't do it, but it took out like some of the skin and then it looked smoother. So those are like the non-surgical ones. And then one patient that I saw that did the skin pinch thing, and that looked really cool. What can I do for non-surgical for a longer chin? That's what I did. Filler, natural filler. I love this. It elongated my jawline, helped to balance my features, gave me just a little bit more highlight on my lower face where most of my highlight before was in my mid face. Yes. Marty said I'm glowing. Thank you so much. I think it's that bio refill. Okay, there's a hollow on my cheek that's not from the under eyes, but past it. What can I do to fill it? I know what you're talking about right here. Probably maybe similar to what I have on that. So that is like these fat pads, separate. You can do filler or you can do natural filler. Sometimes we will still also do a little bit of filler laterally because you don't want to just be full here like that. You don't want that necessarily to be the highlight of your cheek. It depends on your face. Most people want to look, they always say, I want to look snatched. I want to look pulled up. So we go also a little bit back, but you can do filler or the natural filler there. Okay, Jerry over here. Jerry, can you be a moderator that I've never had before? Jerry's telling the people about what happens in the clinic. So I don't know what happened, but Jerry was saying the team will tap you when you're being injected to distract you from the pain. Yes, so we have our medical assistants tap your shoulder. We give you ice, all of that to help distract from the pokes. We also use Botox needle to do majority of our filler. Botox ones are really thin, really small. It's not too bad. There's lidocaine pre-mixed in the filler from the manufacturer. So after you get a few pokes in, that helps to numb up the area. So I don't know who Jerry was telling that to. I'm gonna keep trying to scroll and see if I can find him going back. Okay. Haven't had it yet. I think the drawback for me is the investment for upkeeping with the changing economy. I totally get that. That's why I told them, like, no, like, life first. If you want this, you can. We also have financing for people that they'll like break up their payments. I had somebody come in the other day. She was like, Ginille, I was able to break up my thing. I don't know what her bill was. She like, $125, and I did that over 12 months. And I just came in, I did my treatment, I looked fresh, and she's like, I paid it off, and now I'm coming to do this. Thoughts on nose Botox? Cassie, Botox for the nose, good for bunny lines, good for flaring of the nose, good right here to prevent the tip of the nose from drooping. It works. Yeah, it's all good. Jerry, I love you. Head to Vegas. Ginille has a clinic out there. Yes. So 3 offices. 2 are in LA, Torrance, Los Angeles, Mar Vista area, and then the Summerlin side of Vegas. We have an amazing team at all of them, and I see patients at all of them, and you guys can do virtual consults with me, the team. Everybody is great. You can also consult with Jerry, who is here telling all the people, thank you, Jerry, I love you, telling all the people all the things. I can't wait to see you. Okay. Someone said, thoughts on PDGF for under eyes and potential side effects. I would wait on doing that right now. That is not FDA approved. This was like a big thing in the aesthetics industry. Some people were saying, yes, do it. And then others saying, no, we did it. My patients had horrible outcomes. And then patients saying, I had bad outcomes. I had good outcomes. We're not all on the same page. Like, slow down. The FDA did not approve this for injection underneath the eyes. I would just wait. I just wouldn't do it right now. Like, give it some more time. I let the dust settle with new things, guys. Just settle. Well, hey, Ginille, Malia, I just something to say hi. And sure, the taps did help. Thank you so much. Okay, the patients are here doing the conversation. I can like go take care of the babies. Thank you, guys. I want to say, like, shout out and thank you to the patients. So many of our patients like allow us to share their before and afters. They're getting in here. They're talking about their experiences. This is not just me like telling you guys this. I'm not here to be trying to sell you anything like that. I mean, you don't need Botox. You don't have to get Botox. I'm here to help inform and let you know, like, these things can look natural. It doesn't have to look overdone. These things can be safe for all skin types and all skin tones. I really try to show all different faces, ages, races on here, because when I've been in this for 13 years, the bigger portion of my career, like, I wasn't seeing people that look like me, and that sucked. So thank you to my patients for like sharing their experiences, for helping other people to see that natural, what it can look like. If they didn't allow, their photos to be consented, not everybody does, but a lot of them do. They consent their photos so other people can be like, oh, looks like natural. I've had people like, I never saw somebody that was Indian do it until I saw yours. I never saw Asian male that did it till I saw your page. Like, that's what I'm trying to do, is like show the different faces, have representation, show that it can be natural. I know everybody thinks Botox and fillers look weird, because guys, we can only recognize the weird looking stuff. It doesn't have to look weird. I got Botox and filler all over my face. Like, Jerry, they got Botox and filler all over their face, like, and they look fresh, and like, you wouldn't be able to clock it. You wouldn't be able to know. You're like, what? You did that? That's the whole point. Like, it's going to look like you. It's going to look fresh. Yeah. Microneedling for acne scars? Yes. What can you do for fine lines underneath the eyes? Your retinoid sandwiched with moisturizer, your microneedling, your chemical peel, little bits of Botox, not too much or it'll pull it down. Your natural filler or traditional hyaluronic acid filler if you're a candidate for it. Ebony, she's talking to Jerry right now. I've been on retinoid for 4 months. I don't see a change. Are you using sunscreen? That's a big one, big one. Sunscreen with it, you got to give it time for retinoid. That's like a long-term medication. If you want to like start expediting your results, we can combine it with your skin treatments in the office. Okay, how long does it take for chin filler to heal in the chin? You're going to be able to see the results right then and there. You're going to swell up when you go home. It's going to look the most swollen the second day. It gets like swollen, then it starts coming down. By weeks 2 to 3, your swelling, your bruising should all be chill, and you should pretty much know the result. I'm going to go after this one. It does take 6 to 8 weeks to where you like won't feel little bumps like that are in there. That's for it to completely settle, and at that point we reassess. We decide, should we do more now that it's settled and we can look at your face. So that's why I say 2 to 3 weeks, you'll be in good shape. 6 to 8 weeks to fully settle. If you prep beforehand, avoid blood thinners, avoid alcohol, take arnica, eat pineapple, all of that helps to minimize bruising and swelling and helps expedite your healing. Okay, Jerry, I love you. Jerry, I'm gonna come laser you next time. I got laser for you. Jerry over here answering all the questions for me. Okay. Thoughts on hyaluronidase in the laugh lines? Hyaluronidase is are you saying hyaluronidase or are you saying hyaluronic acid filler? Hyaluronidase is a dissolver for filler. So yes, you can dissolve filler with hyaluronidase. I don't know if you're meaning hyaluronic acid to soften them. Okay. Okay. I got a Kinelog injection to help rhinoplasty swelling. I'm 1 year post-op. Can I book a liquid rhino? Yes. I've treated a lot of people after nose jobs, and they still might be coming in for like, oh, can you make it look a little bit straighter, lift the tip more, or one nostril's bigger than the other nostril? Yes, we do a lot of noses. I said I was gonna go 50 hours ago. Okay, someone said for acne scars, retinoid, microneedling, Aerolase, the chemical peel. Okay, if you have questions, call or text the team at the top of my page, or you can book a consult through there as well. If there's not consult times, guys, it doesn't have to be a consult with me. Like Samantha, she does consults as well. I'm trying to get my other teams, but they're just seeing the patients all day. Samantha is amazing, excellent provider. They book the consult with Samantha and they say, I want to see Ginille. And then they do the dang consult with Samantha and then they say, book my flight to Vegas. I want to see Samantha. She's excellent. I love that girl. So she is very thorough. Like she knows all the things. Book the consult. If you have questions, Hylenex, yes, you have it used in your practice. Yes, you want to get some filler dissolved, you can totally do it. It stings a little bit, but it does help. Hey, Shelly, I hope you're doing so well. Okay, if you have questions, call or text the team. You can message me on here, but sometimes I miss them. Sometimes I'm with patients. The team does not miss a text, and I see every text that goes through. So the number on there, call or text, we'll get back to you. Ebony and Jerry, I'm not forgetting. I'm lasering you or peeling you, whatever. Come. Let me see you soon. I love you. Jerry over here. Thank you. Clocking hours for us. If you have other questions, you can ask Jerry. Or Jerry is not on our team, but he's a wonderful patient and representative. Call or text us. We can set up a consult time. If I don't have consult times, because usually when I come on here, they get booked out really fast. But we'll put some more up. It's just, if I'm not seeing patients, I'm consulting. It's just the whole time. Anyway, lasers for brown skin. Everything we do in our office is safe for black and brown skin. Straight up. Aerolase, we love it. BioRepill, we love it. Skin pin microneedling, hydrofacial, we love all of them. There's a membership. You come in on a monthly basis. You pick one of those. You don't have to pick it on your own. We help you decide the right treatment for your skin based on what's going on, based on your goals. Sometimes we're stacking those treatments. So our patients really love the skin membership. We price them the same. We don't have to be like, oh, that one's $10 less, that one's $50 more. It's all the same price. I don't want you trying to pick treatments based off price. We want to pick the right treatments that's going to be right for your face. Aerolase or microneedling, Ebony, it might be both. If you're saying acne scars, most people with acne scars are doing that, both of them plus the peel. But if your first time is just acne scars, I'd go with microneedling. If you've got acne, you don't want a microneedle. Okay, I'm gonna stop answering questions, guys. Any location in New York City area? Not right now. We see a lot of people out of there and Houston, and my patients have been on me. They're like, just do pop-ups, Ginille. Because I'm like, okay, maybe I will do that in 26. Okay, I appreciate you guys. Good night. God bless you. I appreciate all of you. I hope you have a great day. Bye, Jerry. I appreciate you.